Good evening, everyone. We are going to go over acute myocardial infarction tonight. Acute myocardial infarction, there's actually more than 3 million cases a year in the United States. It is a leading cause of death for both men and women. So a heart attack occurs when there's a blockage that disrupts the flow of blood to the heart. Common causes of blockage are a buildup of fat, cholesterol, or other substances. This buildup causes a plaque to form. The plaque eventually breaks away and a clot forms, and then that clot is what disrupts the normal blood flow. So there are several signs and symptoms that are associated with a heart attack. They are chest pressure, tightness or pain, squeezing or an aching sensation in the chest or arms, and some of that pain might radiate, and common places are the neck, jaw, or back. They might complain of nausea, indigestion, heartburn, or abdominal pain. They could have shortness of breath. They could have fatigue. They could be diaphoretic and really sweaty, or they might complain of lightheadedness or becoming dizzy. And as you can see here, this is a great little picture of what's actually going on in the heart. And then here's the actual blockage that they're showing you what happens. So women actually have different symptoms than men. And they are most common have chest pain or discomfort. So they can actually have a heart attack without having that actual chest pressure that men complain of, that feeling of an elephant sitting on their chest. They're more likely to experience shortness of breath, nausea, vomiting, back and jaw pain. And heart disease is actually the #1 killer of women in the United States. And women are more than likely to brush their symptoms off than men are. They're going to think that their symptoms are related to acid reflux or the flu. So there's several risk factors that are associated. I've got a couple of them right here for you. And so age is men who are 45 and older, or women who are 55 and older. And tobacco use is the next one I have here. And that's actually either their smoking or long-term exposure to secondhand smoke. And the reason that this is a contributing factor is that smoking is thought to contribute to early inflammatory process that causes the platelets to become more sticky. And when those platelets become stickier, then they stick together and clump together, which can narrow the passageway of our arteries. High blood pressure is another risk factor, and this is leading cardiovascular disease is a risk factor to a acute coronary syndrome, and then it actually consists of 40% of our cardiovascular disease deaths. High blood cholesterol or triglyceride levels. These again are a type of fat that will clog the arteries. Obesity is another risk factor. Obesity is associated with diabetes, high blood pressure, high cholesterol, and elevated triglyceride levels, which increase the risk of a patient having AMI. Diabetes is a risk factor because the elevated blood sugar levels can damage the blood vessels that can lead to coronary artery disease. Metabolic syndrome is defined as a cluster of individual risk factors for acute coronary syndrome combined into one syndrome. So they have to have 3 of the 5 risk factors to have metabolic syndrome. A family history of a heart attack. This is males in the family that developed heart disease before the age of 55 or females before the age of 65. Lack of physical activity is due to it contributes to intravascular inflammation. Stress is another risk factor. Illicit drug use, and this includes cocaine and amphetamines. For females, a history of preeclampsia. And lastly, an autoimmune condition. So how is an MI actually diagnosed? So an EKG is done on any patient that presents to the emergency room with complaint of chest pain or chest tightness. And this EKG needs to be performed within 10 minutes of that complaint. An EKG is helpful in diagnosing ischemia or infarction. Troponin is a blood test. It's a protein that's found in cardiac muscle. It's released into the blood as a result of muscle destruction and ischemia. And then lastly, a chest x-ray, which will show the size of the heart and the size of the aorta. And all of these will be done in the emergency room. And as you can see here, I have a diagram of what a STEMI would look like on an EKG. And then this is a graph of how the troponin peaks. So usually you do a troponin at when they come in with complaint of chest pain, and then the high sensitivity ones you will do 3 hours later. So if there's a rise in that, then it's more than likely, if it didn't show up on the EKG, that they're having an NSTEMI. So you will go ahead and send them to cardiology for an evaluation. We come down here. So there's several types of MIs depending on where in the heart it is. So you have your anterior MIs, your lateral, septal, inferior, right ventricular infarct, and then your posterior. So it's going to show you here, if you look at these, it shows you the different leads that it's going to show up in. And then this diagram over here not only shows you the different leads, it shows you which coronary artery is involved. And then lastly, right here, it's going to show you what type of arrhythmias that you're going to see based on what type of infarct that they're having. So a treatment, patients are going to get 324 of aspirin. Unless they're already on a daily aspirin of 81 milligrams, then you're going to reduce that 324 by 81 milligrams. Aspirin is a blood thinner, so it's used to break up any clots, which will lead to improved blood flow through those arteries. Nitroglycerin is given unless there's a contraindication every 5 minutes. You want to hold for systolic blood pressure less than 90. This is due to it being a potent vasodilator, which is good because it reduces preload and myocardial oxygen consumption, but it can also decrease their blood pressure as well. Tenecteplase and alteplase, these are our thrombolytics that are used to dissolve clots, and those are a weight-based dose. And then you have your heparin, which is your anticoagulant, and then clopidogrel is an antiplatelet drug, so that actually is used to prevent new clots from forming and prevents existing clots from growing. The main thing is the patients will need to go to the cath lab for a primary PCI. And as you can see here, this is what they're going to do during a PCI. Thank you very much.